Too weak to cry, babies are only spoon-fed drops of water here.
So the problem with this one is it has more than a month's profuse diarrhea. So another kid we have to be very patient with, and what we are doing is trying to get the GI tract working again with little bits, because in other hospitals, I mean, there are proper hospitals in Circa, they get the medical care, but if they see a child like this, it immediately gets a drip.
Yeah.
And then the kid is a little bit better, but when the kid goes home, of course, they fall. Because with the drip, you never train the GI tract to start working again.
GI tract, you mean
the stomach
the
and the intestines.
system.
Yeah, it's a gastrointestinal tract. So you need to train that. And if it keeps diarrhea for days and days, you have to look for the cause of it. And mostly a kid that comes from other hospitals here has seen every antibiotic in the book already. So it's not a question of giving more antibiotics. It's much more observing, but it's out of the danger zone now.
MSF has set up a nutritional program to tackle the devastating malnutrition in the area.
What we do is we have teams that are screening within the camps, and when they find severely or moderately malnourished children, and there are no medical complications, we're able to provide right away a regimen of therapeutic food. It's called Clumpy-Nut, basically, and it's a ready-to-use food. There's no water that is necessary. The child just opens up the envelopes and eats it. It's kind of like a peanut butter paste, and it is high in vitamins and all the necessary nutrients for the child to grow rather quickly and gain the weight that is necessary. And when the children do have severe medical complications, then they're referred here to our intensive feeding center, where we have to treat the child for medical complications and also for malnourished.
Anyway, let's go and see this baby. This is one of our, is actually a problem child. Can I see the baby, Mama? Yeah, this little one. She's doing quite well right now. It's a 4.5 months baby who had a failure to thrive actually since she's born. Typical for many of the babies we get in the young children. It's the week.
How old is she? Because
4.5 months.
Tiny.
Yeah, 2.2 kilograms. And when it came here, it was 2.0, so it's already a success. But it's typical for many of the kids we get. It gets worse because of the flood situation, but the ones that fall first are ones with some comorbidity, kids that have some other reason for failure to thrive, as we call it. And this one needs a lot of patience, of course, and a lot of extra feeding. But she's doing well.
How does she compare with the size of a normal baby, I mean, in terms of the limbs and...
Well, the average weight of a child born in the United States is much more than the weight this child has now. It's very well. You can see the little arms. It's just all very, very weak. I mean, but the face is the most impressive. With the sunken eyes, the big eyes, and you know, the grandfather face.
And we saw many more babies in a similar condition that day. Water levels remain high in many remote areas of Pakistan, in particular in Sindh, and with it are thousands of people cut off for weeks on end, waiting for help.